Hi, folks. We are back. I'm Joe Messino here with the one and only, the gut guy, Dr. Len Bransowitz. We love that nickname, Len. We love
Uh,
it. It's
I'll
perfect.
go to my
It's right.
grave with that one. You know it.
Yeah, you got to. Now, Dr. Len is one of the guys that's been around since the beginning of this, folks. He went to my alma mater, Duquesne University. Yeah, and the School of Pharmacy there, one of the best in the country. So Len has the distinct advantage of coming from, pretty much the allopathic side originally, and then crossing over, taking the best of both worlds. Len's been on the radio, has been involved in the nutrition side of the business, had a big following on the radio for many, many years here in the Pittsburgh area. And now he's down south. He's in the great state of Florida. What, in
Absolutely.
Tampa, Len?
Just outside of Tampa, right on the coast,
Just
Tarpon
outside of
Springs.
Tampa? Okay.
Yeah.
Good, good. Yeah, so Dr. Len, we call him the gut guy because he's had probably more clinical experience than anyone we work with on helping people heal the gut, which is the major starting point causing most of the things that we're experiencing out there. And of course, Len, we have to start off with you telling the story of how you brought GI Complete into your practice, because that started everything off.
Amen. When the information, the file that I have in front of me right now, I'm going to be sharing with you. So, put on your seatbelts because I'm going to roll through this stuff pretty quick. And let me just say this:
Okay.
we, Jamie asked me and Joe asked me to do case studies. Now, when you do case studies, the name has to be changed to protect the innocent, of course, as they say all the time. So these are
Sure.
actual case studies that I've been involved with, actual people, actual cases that all tended to go to gut health. So some of these you're going to say, like, you really went to gut health when you dealt with this. Yeah, well, we're going to do that. Now, here's how GI Complete and the whole story of that. Coming from a pharmacy perspective and having worked in the field of oncology for many, many years, I found myself getting drawn into two separate but distinct calls for help. Number one was cancer, which is very difficult to work with. And number two was female hormone issues. Now, and again, Joe and
Still
I
very
will say,
difficult to
when
work
you're
with.
dealing with
Right.
a postmenopausal woman, it's not an easy place to be. So at that point, I had a compounding pharmacy, and I was trying to work with getting some of these issues fixed. How do I get hormones balanced? How do I get them into the system? In the field of cancer, how can I support that the chemo or radiation or whatever they're doing is not causing any damage? And as I worked with people over the course of years, I started with Mercy Hospital in Pittsburgh, and then I started working my way forward. I ran into this wall continually falling up that says, I'm putting enough hormones into this menopausal woman, or I'm fixing enough hormones in this young lady that's having dysfunction, but I'm not getting the results that I should. So we started digging a layer deeper, and we found out about, for instance, hormones can be reabsorbed through the gut. Well, how do I stop that from occurring? I can't go down with a little man and put it there and say, stop, you can't go there anymore. Or in the field of cancer, when we started to overwhelm the liver and the kidneys, how do I stop that from occurring? So everything, as we researched, went back to gut health and a syndrome that we lovingly called leaky gut syndrome. You can look it up anywhere, where the gut becomes permeable. So how do you fix this? That got to be the issue. We knew about probiotics for many, many years. We'd dump a boatload of probiotics in, would get a little bit of relief, but just not enough. And then we had this continuation of, if we put too many probiotics in, people were having dysfunction, diarrhea, constipation, all kind of other secondary issues. So we started looking and saying, one of the things that could help this is aloe vera. One of the things that could help this that we actually got from a research piece was something called zinc carnosine. We said, man, this form of zinc can make a big difference in the whole digestive tract. And then we started looking at all the other supports from glutamine on down, and we said, I'm going to end up giving somebody 7 different supplements. So when we took all this information back to Jamie and we said, look, this could be the most important supplement that you develop. Period. Go back to the drawing board. Here's what we want. Here's the ingredients. And we tweaked it and we went sideways and we went left, right, and up and down. And finally, we worked on taste and texture and all the above. And I think slowly but surely, it became the #1 utilized supplement by Nutritional Frontier. So it came from nothing all the way up to being one of the most utilized supplements on the market today, not just from Nutritional Frontiers, but for Nutritional Frontiers and individuals and practitioners around the country. So it's become the most important part of my practice. And that's what I'm going to share with you today. I pulled up case studies, and I could probably pull up 50 more, all of which dealt with using that prep, that particular prep, as the foundation. So it becomes a very, very important role. So
I tell that to doctors all over the country, Len, that you in particular use it as your foundation formula for everybody that comes into you to see you in your practice. And didn't you try it once on somebody and then it worked and you ordered a whole gross of them?
Yes, exactly.
Yeah.
It was like once I got the results I was looking for, we started using it with everybody. Now, let me just say this. This has been a rather troubling week here at the household, the Branswitz household. We adopted another dog. So now we have 4 little puppies. And as soon as we introduced this 4th one in, our 2 oldest one, Sylvester, who is 13, and Kobe, who is 10, started having gut issues. Well, I'm the gut guy. So yesterday we go to the vets, and the poor dogs, one's constipated, one has diarrhea, and we're having all kind of discharges, and it was a mess. So we went to the doctor, and the doctor says, gee, maybe we can give him an antibiotic, or maybe we give him, and I said, all right, you do what you got to do. Here's what I'm going to do, doc. So guess what? 2 of my dogs now are on GI Complete. We're sprinkling it in their food. So this is a brand new use, can be used with animals as well. And I will tell you this, the one dog that had loose stool had a normal bowel movement this morning in one day. One day. So it is powerful. It can be used for a lot of different cases. And that's what I'm going to show you. I'm going to think outside the box today. I'm going to roll through these, Joe. I probably have 20 of them here. I don't think we'll have time to do them all, but I'm going to try to get out as much as I can today.
All right.
You ready? You got your seatbelts on. Okay. Let me just say this.
Ready.
Human gastrointestinal tract, we got to think about this. Digests your food, absorbs your nutrients, but it maintains metabolic homeostasis, which means our metabolism, how we assimilate food, how we burn food, how we make enough energy to keep us alive. That's the way God created our bodies. These microbes that resolve in our gut harvest energy from the food we eat. Now, also in the gut, there are chemical signals that act right within the gut and actually work body-wide. So there's chemical signals that take place from the environment inside the gut, such as the gut-brain axis. Now, due to this interplay between the gut and our brain, we start to see science discovering gut health. Let me say this. I'm reading from an article called The Meta-Analysis of Gut Microbiome Studies Identifies Disease-Specific and Shared Responses. This is an article that just came out in the Journal of Nature Communications, published, that said, metabolic disorders, links to the gut, #1. That includes diabetes and obesity. Inflammatory situations, such as arthritis and autoimmune disease. Strongest link, gut health. Neurological conditions such as Parkinson's, etc. Strongest link, gut health. And the biggie that just got cited and said, if you're going to work with somebody who has cancer, start with the gut. So as you go through this whole article, and I'm just going to summarize it, it basically said, we found extremely strong links to the most pressing health issue in the United States today, obesity. Obesity. That says we can look at thyroid, we can look at the food you're eating, the exercise you do, we can look at all of those different things. And we've all heard and seen the information and the infomercials about this is how you lose weight, this is how you lose weight, this is how you get balanced. If you don't have good gut health, you'll never lose weight. Let me say that. Obesity is the #1 health condition in the United States right now. It's leading to cancer, it's leading to diabetes, it's leading to cardiovascular disease, and it's the #1 disease state that's killing Americans right now. And if we could just sprinkle, take an airplane and sprinkle GI Complete over the entire 330 million individuals in this country, we could save lives. Now,
and isn't it incredible that when, these debilitating disease states, diabetes, cardiovascular, cancer, if you go into the hospital for something like that, the last thing they worry about is what they feed you, because they feed you the crappy hospital food, including things like Jell-O. I mean, are you kidding me? So it's just, I can't get away from it. Right?
You go in to be treated for something serious, you're in the hospital, and we're feeding you food that disrupts the gut health. Okay, we'll put you on a porta potty. But you're not curing anything. You're not fixing anything. You're going to go home not feeling any better than when you got there.
Right.
Now,
maybe making it worse.
Probably. Now, part two of this is when I was in school studying to become a naturopath, one of my doctors, Dr. Russ Jaffe, gave me a piece of paper called the Anna Karanina Principle. I'm thinking, Anna Karanina. Well, Anna Karanina was a famous book written by, I think, Tolstoy, Leo Tolstoy, years ago. And I'm thinking, I didn't read that kind of nonsense. I wasn't an English major. What's that mean? And he said, in the book of Anna Karanina, the opening line in that book said, all happy families are all alike. Unhappy families are unhappy in its own way. And I said, okay, Russ, explain this to me. What's this have to do with science? He said, basically, when you have healthy microbiomes and your health is good, everything is consistent. So you can take 1,000 healthy people and do an analysis of their microbiome. It's all going to be the same. But when you have disease states that are introduced, 100% of the time, you will find a disruption in the gut microbiome. If we do a stool analysis, whatever the situation is, we will find disease-associated microbiomes to be off kilter. Now, going off of that was strong links to a number of different disease states that I'm going to go into. So I want to start now giving you a few case studies. Get ready. Joe, have you heard about monkeypox?
Yeah. Oh, yeah. I did hear a little bit about that. I don't really watch the news, Len, but I did hear that. Yeah.
Yeah, it's this strange disease that seems to be linked to somebody having sex with a monkey a long time ago.
Yeah.
Okay, I don't want to go there. But anyway, it seems to be spreading in the gay community primarily. But we've all of a sudden, the government, Joe Biden and the crew, have decided to order like 100 million doses of monkeypox vaccine.
Oh.
Now, it's a very debilitating disease that gets breakouts throughout your whole body. And it typically was linked to traveling to countries like Africa. Now, I'm going to tell you about somebody named Brandon, a very wealthy fellow that lived in the northern suburbs of Atlanta. He was a counselor. He worked with big vice presidents and presidents of corporations. He had retreats and did all these different things, but he traveled to Africa a number of times on safaris and came back with a condition. This is before we knew what monkeypox was, but he had this blister breakout in his entire body. He ends up at the Mayo Clinic. He ends up at the Piedmont Health Situation. He ended up at, I'll bet you 5 different hospitals trying to figure out what this skin condition was. Well, I started working with one of his doctors locally, and we did have to use antibiotics for a while. And we got the right combination of 3 different antibiotics, and we got this rash on his entire body. He was debilitated laying up in bed. We got his whole situation corrected. we got the things resolved, and now we got flaring diarrhea to the point where he was re-hospitalized because of the antibiotics for 4 different times, had lost weight. He went from 189 down to 132 pounds. And nothing that the hospitals can do outside of giving him fluids continually. They basically said, if we don't get this stopped, you're going to die. So I'm just going to tell you the sum statement of what we did. We introduced a lot of different things, but we started to make a cocktail of Frontier Fiber, GI Complete, and IgG together. He had a housekeeper that would mix this for him in a 6-ounce glass of water, shake it up with some ice, and he would drink it 6 times a day. 6 times a day. In a matter of 2 days, the diarrhea stopped. In the matter of a month, we did it from 6 times a day to 5 times a day to 3 times a day. He's back up to 190 pounds, back to normal, continuing the Frontier Fiber, continuing the GI Complete morning and evening, and he's got his life back. Now, this is a rather extreme situation. You see a lot of people coming out of hospitals that are having these huge issues like this, that medicine has nothing to control it. So right now we have Saccharomyces added back into a situation. He's got his life back, and he is ecstatic about the results.
Len, that was 6 full doses.
6 full doses a day.
Full doses.
Now, again, remember, folks, if you're listening to this, you don't just go out and do this. You need to do this under the auspices of somebody trained. Contact Nutritional Frontiers. They can put you in touch with somebody in your local area that knows how to utilize these preps properly. This is just an extreme example of somebody whose life was on the line that turned themselves around. Story number 2. This is a 12-year-old girl by the name of Carly, whose parents called me and said, we have a problem. We have 3 children. She's the oldest. And at various times, her mood swings would get so dramatic that they would end up having to lock her in her own room. She would get so vicious that her brother and sister were scared to death of her. They ended up institutionalizing her 3 different times. They finally went to a doctor who was supposedly an expert in this, who said she was ADD. We traced it back to the fact that she did have a tick bite a while ago, and we did some diagnostic tests on her to find out that she did have Lyme's disease, and she did have a lot of other issues. They ended up putting her on Haldol to keep her calm. There was one night that she got so upset that she actually ripped the door handle off her door to get out. This is, again, a rather extreme situation. Now, I had pulled a study out that said gut microbial community, which influences our mood, can be shaped by modulating the gut ecosystem through dietary strategies. So this case study was, this girl ate horribly, but we had to get aggressive again. So not in place of these medications, but alongside of these medications, we started using GI Complete, in her case, 3 times a day. In the morning before she went they ended up putting her into a school where she could get individualized treatment. We actually had to call the school and have it given to her. We'd make it ahead of time, where she'd have GI Complete, breakfast, lunch, dinner, breakfast, lunch, dinner, and we did that over the course of 30 days. Slowly but surely, her mood changed. Now, the issue here, as I started saying from the very get-go, was that when the body is making neurotransmitters, in this case, this girl had too many stimulatories and not enough inhibitories, the body starts to reabsorb these things through the gut. And when they hit the brain, we run into situations much like this. So here's an indication that says, if I can fix the microbial community of her gut, the mood, the balance, the ADD, the viciousness that this little girl was experiencing slowly but surely went away to the point where she's now back with her parents, back in her regular school, and back along with her brother and a sister and not having any issues. She's now 14 years old.
Again. Hey, Len,
Now,
let me ask you, did you eliminate anything while adding this in?
we eliminated Cocoa Puffs, Lucky Charms, and one other Fruit Loops, I think, that was the typical morning breakfast for this family. And we went to more of a whole foods diet, which she resisted dramatically. But we did have to make a lot of dietary changes to actually help to support. We put her on a much higher fiber diet. We had to get her to like vegetables again. She didn't like vegetables at all. So we got her to the point where the parents actually started going to Sprouts. You know, I'm not going to give a shout out to Sprouts, but they were able to get more of a natural food base for her so that we were able to, again, get her to like the vegetables. We made little dips. I think they ended up watching you on your show a little bit about cooking. They got some ideas of cooking good, natural, healthy.
Great plug, Len. Thanks. Cooking with Papa, everybody. Check it out.
There you go. All right, story number 3. Ruth Ann. Ruth Ann's 32 years old. Been married for 5 years. Been trying to get pregnant for 5 years. She had 2 miscarries along the way. She had been through fertility treatments and managed to come to the point of almost total frustration where they were actually, her and her husband are actually contemplating adoption. So she comes to me. Now, we utilize a lab called Diagnostics, which is getting saliva samples from a patient 13 times in the course of a month so that we could have an idea what their menstrual cycle was. And what we found out was there was a major estrogen surge at the wrong times during the course of the month. And I don't want to really delve into that too dramatically. But the one thing that we did is that we used indole 3 carbinol, or the Estro Cleanse Prep. We used it twice a day on a regular basis to try to bring some semblance of normality back to her menstrual cycle. We did that for 30 days. Next level, we introduced GI Complete once a day, IgG on the opposite time. So we did the GI Complete in the morning, IgG in the evening, and we went with the standardized probiotics, the Frontier Biotics, 2 in the morning, 2 in the evening. We did that for 60 days. And I just love it when we said a study that I presented to them was the role of the genital microbiome. And in a female, we have to understand that the microbiome, the gut, also includes the genital tract and the vagina and the site of where we're going to try to create a child. So when we have infertility issues, we have to make sure that we get that part of the body as well as the gut, and this is going to include the gut, back into a semblance of normality. The pH gets back to normal. So when you're using something like GI Complete and IgG, and you're using it over the course of 30, 60, 90 days, it's going to get to other parts of the body. And in this case, the microbiome that was responsible for fertility. And this young lady now has a lovely little girl. If it was going to be a boy, they were going to name it Lenny. But that was, you know, it's funny because after I worked with her and I got the call that she was pregnant, my wife says, "How's your day doing?" And I said, "Pretty good. I got a call from Carly and I got her pregnant." And it was like, wow.
Hey, they could have called her Lenore.
Lenore, I know.
All
right. Story number 2, Rochelle. Rochelle, 46-year-old premenopausal woman. Presented to a dermatologist with an itch, a body-wide itch from the top of her head to the bottom of her toes. The doctor, of course, the dermatologist, treated her with steroids, gave her boatloads of topical things. She had no visible rash. They tried to do allergy testing. They did the time testing where they were actually injecting into her skin to find out if she was allergic to anything. And they put her on steroids, topical steroids, and got nowhere. It was to the point where she was starting to scratch her skin off in various spots. So we took a look at this, and I sat down with her and I said, "We have to get you some relief." And I pulled some old data. that said you can build what's called a steroid bridge. When you have situations like this where the body cannot defend itself anymore, we're having an itch and we have no idea what's causing it. We looked at her diet, it was clean, it was a whole foods diet. We looked at her environment, we looked at the soap she was using and everything else. No exposures, no other major problems. So we did this thing called a steroid bridge where we used, and just follow this for a second, buffered vitamin C. We took 1 capsule every hour while awake. That's 18,000 milligrams a day. We followed that with quercetin, powerful anti-inflammatory, 2 capsules in the morning, 2 capsules in the evening. In the human body, when you use that, you use calcium ascorbate, buffered vitamin C, and quercetin together, we actually made a natural steroid in her body. We did this for 4 days. Very cumbersome. She started to get relief. Once we started to get relief, we kept her on a split dose of buffered C and quercetin and added Air Max. With Air Max, we came in as, again, another layer of relief toward allergies, 2 capsules twice a day. We kept on the quercetin, we kept on the buffered C. We did this for 30 days. We got more relief. Now we had to hit the home run. We're into month 3. We got it where she wasn't itching anymore. And this is, again, going down to a study that says microbial fermentation of dietary fiber in the gut stops and prevents all ALL, allergic reactions. Can I read that again? Microbial fermentation of dietary fiber in the gut prevents all allergic reactions, says researchers. That's pretty interesting. So I went back to the drawing board in month 3 and said,
A lot of allergists out of business, Len.
Exactly. So we added GI Complete, Frontier Fiber, and made a cocktail of it along with the IgG. We put it in one of these mugs, and we had them drink it twice a day on a regular basis over the next 60 days. Air Max in the morning, quercetin in the morning, buffered C in the morning. That's a lot. But after 90 days, it was 90 days, all of whatever this was, which was causing her to itch her skin off, went away. But again, most people wouldn't think of using gut support, and again, in this case, we used it as phase 3 into this whole thing to try to seal the deal.
Right. Wow. That's and there's a few things that need to be mentioned about that, Len, is that it wasn't a drug that she took that's fixed it overnight. It's not going to happen. It's not going to work, right? And it kind of coincides, the 90 days kind of coincides with how the body regenerates itself. And so what you did was give it the nutrients it needed to regenerate on the positive side and alleviate what was going on in there. I mean, that's just pure science, but it's so simple. It's just not easy, right?
Well, when this woman actually called me, and we kept in touch with her like every week, and when she started to see the relief, she said, I doubted you all along. I didn't really think the way you were approaching this could have any effect whatsoever. And she said, I was afraid. I was really afraid, not that there was going to be any harm with what you were doing to me, but I was afraid. And she sent me this, and I wrote it down that day. It's on her file. Never be afraid to try something new. Remember, amateurs built the Ark, professionals built the Titanic. And I've kept that as a little mantra. It's on my desk, along with my Yoda little quote that says, there is no such thing as try, only do.
Do or do not. There is no try. Yes.
Now, I'm going to take a little pause for the cause here because I have to give a plug for me.
Okay.
August 6th, Sheraton Station Square. Healthcare professionals watching this right now. I have been challenged to get the 10 most common health situations where you as a practitioner can help a person transition from pharmaceuticals to nutraceuticals. I'm finally being asked to use my pharmacy background and put it into a teaching time. So I go on at 2 o'clock. I'm the last person that is speaking on Saturday. Full information is on the Nutritional Frontiers website. If you're a practitioner, well, let me say this. If you go to somebody, let's say you live in Latrobe and you're going to this practitioner or that practitioner, or you're living in Erie, Pennsylvania, whatever, and you're watching this, and you need to go to your practitioner, somebody you're working with, and say, you know what? You need to get to this. You need to get to this and learn. And don't ever look at it like, oh, well, maybe, are you telling me I just don't know enough? No, I'm saying Nutritional Frontiers has positioned themselves into the field of teaching and training and trying to get you to a point where you can help more people, period. And it's part of my passion anymore. Jamie likes to say I retired. I didn't retire. I'm semi-retired, but I now have the opportunity to do much more teaching and to try to take younger practitioners by the hand and say, here's how you do it. Here's what I've done over the last 38 years. Here's the way you can add this to your practice. Watch. We're going to do it carefully. We're going to take you through the steps that are necessary, because 80% of people that present to you are going to be on a pharmaceutical of some sorts. And out of that 80%, nearly 90% of them would love not to be on a pharmaceutical. And we're not going to go.
Yes, that is August 6th at the Sheraton Station Square here in Pittsburgh. A lineup like you wouldn't believe, anchored by the one and only gut guy, Dr. Len Brancewitz. And we have Judy Mikovits, we have Robert Scott Bell, and we have Dr. Tracy Stroup. I mean, what a lineup. And, it's already standing room only, Len. We're at the sold out point, and, it's standing room only, but who knows? Maybe we'll get them to open it up a little further, but it's going to be a packed house. House.
And I'm looking forward to it. It's good. Being in Florida now, I don't get back to Pittsburgh enough to see my kids and my grandkids. So I'm looking forward. We're coming in Thursday, and we're going to be able to spend a good part of Friday with my grandkids, which will be nice. And then I get to go down and do all these teaching. So I'm looking forward to it.
Yes, it's going to be fun. And then we got the boat tour right after that. So that'll be fun too.
Here is the next case study. And again, I want you to think outside the box for just a minute. There's not that many people still smoking. Thank God. I smoked for many years way in the past. It's been almost 20 years since I stopped. But there's a lot of people that have transitioned from cigarettes to those vape pens. You see a lot of the kids doing this.
Yeah.
And a lot of people that have still gone into chewing. There's still a lot of people doing that. So would you ever think that you could do gut health to help somebody stop smoking? I had to think outside the box, and I went to the Journal of Oral Microbiology, and I said, case study that says the mouth is the beginning part of the gut. Oh, really? So I'm going to tell you about Tripp, T-R-I-P-P, a good old boy down in Georgia that liked his chew, just like that one country western song, chew tobacco, chew tobacco, chew tobacco, spit. They did this, and his wife said it's so disgusting, but we couldn't get him to stop. So Tripp had been to his doctor a number of times. They tried the patches. They tried the little chewing gums. They actually tried an SNRI, which is a pharmaceutical, a norepinephrine reuptake inhibitor. Didn't help. Tried a dopamine booster called Wellbutrin, which they said had worked. Still didn't have any help. So we looked at this and we said, not only is he chewing, not only is a former smoker, but in this whole world of maybe your kids now, and you'd say, I'd rather have them use that vape pen rather than cigarette smoke. And I'd have to say, yeah, that is a better choice. But we're still in this world of much in the world of nicotine. So I went to Trip and I said, here's what we're going to do. Here's what we're going to do. And we did a neurotransmitter test on him, which is a salivary test where we can get neurotransmitter levels. And we found his dopamine levels to be extremely low. So what we did, we came in with, first step is that we started a mouth rinse of SBCs, opened up, and a little bit of aloe vera juice, GI Complete, put in there together, swish and swirl and swallow in the mouth. And we made sure that he held it for at least 60 seconds. Did this 2 or 3 times a day. At the same time, we started layering in the multi-amino acid preps. We started putting in amino acids. Now, this is a fellow that was a weightlifter. He did testosterone replacement, and he did mega doses of protein supplements. But he wasn't getting the essential amino acids that he needed. So we started adding the amino acids as a way of boosting dopamine levels in his body. First month, not much of an effect. So we doubled up on the GI Complete in the mouth rinse and the swallow. We took it up to 3 times a day, he's a plumber. He was capable of doing that for us. Slowly but surely, he said, the need for that nicotine boost was starting to go down. As soon as we hit that point, I said, all right, time out. We got to continually do this. This is where we drew on Adrenamax. Okay, because nicotine stimulated the adrenal glands. He's been doing this for so long that his adrenal glands were probably in a complete state of shock. So we added Adrenamax 2 in the morning, 1 in the afternoon, on top of this GI Complete swish and swallow with the 1 probiotic in it. Within 90 days, he had stopped chewing, and he has never looked back. So again, does that work for everybody?
Saved his teeth too.
Yeah, so
right?
I think
we saved his teeth.
Probably saved his life.
Yeah, his life.
All right.
Wow.
Another study. You ready for I got a couple more, and I think we may be able to get these in. Gut microbiome may be the key to combat muscle decline called sarcopenia and aging. You know, when we go to the gym and you put your arms out and you start wobbling it, and over here it starts to wobble and get those creases in it, and it looks like wax paper. Don't deny it. Go look in the mirror sometime, folks. You know, when you hit your 50s and 60s and everything starts to sag. So I'm going to talk about Dave.
50 years of push-ups will prevent that, though, Len.
Yeah, exactly. That's you.
50 years of push-ups.
Yeah. Dave, 67, retired, was noticing that he was losing muscle tone. So I said, Dave, here's what we're going to do. You got to realize your gut bacteria, listen to this, produce a compound called urolithin A, a metabolite that breaks down polyphenols such as in pomegranates, nuts, and berries. Pomegranate, nuts, and berries. Where have I seen that before? Purples. Yep. Oh, okay. Here's what we're going to do, Dave. We're going to come in now, and this is going to be a whole new switch. We're going to start you on the Pro Purples because it has all of those polyphenols in there that we could utilize in the gut. Now, we're going to mix that again with GI Complete. Another example. Purples, GI Complete together, drink it morning and evening, morning and evening. This shows that first thing that happens is that we increase the efficiency of the mitochondria. Okay, so could aging within skin and in muscle be the inability of the mitochondria to keep working? This is little powerhouse engines inside of every muscle. So we go back to D-ribose. Okay, and we go into a D-ribose prep or energizing D-ribose powder. We put that together. Purples, D-ribose, GI Complete. And we started using this on a twice-a-day basis all the way through. Within 60 days, he got back into the gym. Within 90 days, at age 67, he started to do weight training. Now, we're 6 months out. This doesn't happen overnight. 6 months out, he sends me a picture. The muscle fatigue is gone. He keeps going up in the amounts of weights that he can do. And all that crunchy little skin that was showing up underneath his triceps has now tightened up. Hallelujah.
6 months as opposed to 67 years, right? It took you 67 years to get there.
Right.
All right. 6 months is a short period of time to reverse it.
Next case study, triple negative breast cancer. This is Heather. She lives in Sewickley, Pennsylvania. Third reoccurrence at age 72. On 2 hormone blockers and Ibrance. Taking a major toll on her body. Third reoccurrence. Keeping in mind a study from the National Cancer Institute that said when you get to, not the first time or the second time, but when you have the third reoccurrence of a cancer like this, triple negative, which means it wasn't linked to any hormones, what do? Medicine has nothing for her except to use some of these intense drugs. They're all immune builders. So it says the human microbiome and this type of cancer. And there are studies after studies in the National Cancer Institute that says if I can get involved here and improve the human microbiome while we're using these kind of hormone blockers and immune builders, we can start doing some difference. So again, GI Complete was the first level that we put in here. Then we went in with Immunomax, and we used that in the chewable form, not the swallow form yet, in the chewable form, and we used 3 or 4 of those in the course of a day to try to support what this Ibrance was doing in her system. GI Complete, and using some boosting of the immune system. We followed this with a lot of probiotics. So we used Frontier Biotics. We used 2 capsules 3 times a day, which is a lot. And we kept her on that for the course of the next 6 months, to the point where the doctors finally have said, just recently, I don't think you have cancer anymore. And it was like...
Can you imagine what she felt when they said that after 3 bouts? Can you imagine what she must have felt?
It's unbelievable because that's where we are. Okay, we have a few more minutes. Let me see how many more I've got here. I've got Dave in Slippery Rock. Good friend of mine, postal service man. Ends up having a heart attack at age 67. And the doctors could not figure out why. His cholesterol was low, his inflammatory markers were low, there was nothing else going on. Nothing. He's been in and out of the hospital 7 or 8 different times, and the doctors don't know what to do. So when Dave presented, this is almost a year ago now, we said there are a lot of dietary nutrients that can support here, like L-carnitine, et cetera, and a lot of other issues. Collectively, if we start introducing these nutrient factors in here, I used a prep called Cardio Stack, which I started to layer in with him. But we have to make sure he was absorbing that. And this was the contributory role of the gut microbiome in cardiovascular disease that says, if we can calm the bacteria in the gut while we're layering in something like Cardio Stack, I can get higher levels of the carnitine and the good nutrients that are supporting heart health, and we can stabilize him. What's happened, because I just talked to him yesterday, is that the doctors have now taken him off the statin drug, which he had no need for. They've taken him off the blood thinner, which he had no need for. We layered in the Omega HPD. We layered in the Omegas morning and evening to take the place of the blood thinner he was on and lower inflammation in the body. And we're hoping now over the period moving forward, we continue to do gut health along with GI Complete, along with some other nutrients, that we can get his heart strong enough to recover from the heart attack and move on without having any other issues. Lastly,
I mean, that just spans the spectrum of what people are affected with today out there, Len. I mean, cancer, heart, mood, digestion, weight loss, weight gain, muscle loss. I mean, this is it. This is what people are faced with after years, decades of a standard American diet and the American Medical Association.
Amen to that.
So,
now,
right?
I just, while we were speaking here, I just got an email from a friend of mine. Her name's Wendy. She lives by the University of Tennessee. So she's up in Tennessee and she's listening right now. Hello, Wendy. She sent me an email. She said, I didn't get a chance to send it to you yet, but I heard you talking about this. Wendy went through a lot of issues. Losing a spouse, losing a child, major stressors, and started up the path of antidepressants, anti-anxiety meds. They had her on the highest dose of sertraline, which is Zoloft. They had her up to 200 milligrams. Normal adult dose is 50. They had her on clonazepam in an extremely high dose. She started, when she did all this, of every joint in her body starting to hurt. She lost sleep then. So we started a cocktail with Wendy of GI Complete, X-Flame powder, and Buffered C. Simple concept, right? Morning and evening. Morning and evening. Let's see what's going to happen. I've gotten now 3 updates. Just a quick update, she says. I've now gone from 200 milligrams to 50 milligrams of sertraline, and SO in capital letters, much better. Anxiety is almost gone. Pain is better. I'm now sleeping. Almost off of the clonazepam. Can't thank you enough for helping me get off the sertraline. My doctor seemed skeptical. He did not understand what you did to help me this way. So I can't wait to tell him that I listened to you today. I have a physical next week. Blessings to you, Len, and everybody at Nutritional Frontiers. Wendy.
Wow. That statement says it all, Len. That says it all. My doctor didn't understand what you did. There it is, folks.
Now,
so come August 6th, we'll educate some of those doctors, right?
Amen. Last study, and this one just came out recently. A vegetarian-derived phytochemical tackles antibiotic resistance. So I'm going to tell you about Amy, okay? The love of my life, my dear daughter. She's going to kill me. 37 years old, had dental problems, and went from one antibiotic to another antibiotic to another antibiotic to another antibiotic to the point where we had complete antibiotic resistance, and we were starting to disrupt the whole system. So this article came out about vegetable-derived phytochemical. You know what that vegetable-derived phytochemical was? That broke down antibiotic resistance. If any of you are out there have ever come upon that, indole-3-carbinol, which comes from broccoli. Ooh. Guess what? We started on Estro Cleanse and GI Complete. Got off the antibiotics. Got the dental problem under task. Stopped the antibiotic resistance, because the way we were going, if she ever needed an antibiotic, we weren't going to be able to have one that would actually work. So now we're on SBC, Saccharomyces, once a day, Estro Cleanse, once a day, GI Complete, only twice a week. And we've gotten beyond all those issues.
Wow, this just speaks volumes. There's nothing, no lecture, workshop, training that could possibly be more important than actual live case studies of you and your patients, Len. This is just real world. Everybody that hears this, that should be listening to this, should have hope. And then you have to take the action, right? Because these people put the effort in, didn't they? They just didn't sit around. They put the effort in. That you put the protocol together, but they had to put that effort in. That's why I keep saying it's simple, but it isn't easy. It takes effort.
Never be afraid to try something new. Now, let me just make another comment, because I've seen this and I've heard it even with my own patients. I know inflation's at an all-time high. Never been this bad. Went food shopping yesterday, and what used to cost me $150 when we went to Aldi's to do our food shopping was this time $280 for almost the same thing. It's ridiculous. And I understand that a lot of us are on fixed budgets and we don't have room in there. But let me just say this, coming from 38 years of medical practice, there is no price you can put on your health and your family's health. When you're looking at a budget, this isn't the time now to say, well, I can't afford that GI Complete anymore. Let your health slip. You're going to be paying in the long run. This is the point where you have to say to yourself, I'll try to find that money somewhere. I know I'm working with my practitioner. I know I need these various things. I know I gave you a lot of different case studies today that said, man, you had some people on 3 and 4 things at a time. I know that can be pricey, but they came through the other side of this by solving what that problem was. They cooperated. They were willing to step out. They were willing to take a chance, and they got their health back. So they invested in their health at a point, to the point where they got to the other side. Don't nickel and dime these things.
They can cut out, Len, right?
Yeah.
Cut out the Starbucks 3 times a week.
Exactly.
Guess what? You can now afford 2 bottles of GI Complete. Come on.
They do it
3
3 a day.
a day.
There you go. That's what my thoughts are. If anybody needs any further insight, I can give you a toll-free number where you can reach me. We set this up just so that you can reach out. It's 888-231-5325. 888-231-5325. Just call and leave a message, and it'll get to me. And if I can be of any help to you or to your practitioner, Jamie has me positioned now where I'm going to start doing a lot of work with practitioners to try to help them within their own practice think outside the box. Think outside the box. And the takeaway message from today is the microbiome from the top of your head to the bottom of your feet is critical. Your skin is a microbiome. Your brain is a microbiome. Your sinuses do. Your throat does. Your gut does. Think about that. That if you're getting to the point where there's frustration in your medical care, start to think maybe it is around my gut health. And if we can go in and try to calm that down and fix it, it's rather simple to do with a prep like GI Complete. It can make a world of difference in your health.
Wow. Powerful, powerful. Thank you, Len. Dr. Len Brantzwitz, everybody, the gut guy. And he'll be here August 6th in Pittsburgh. If you get a chance, don't miss it. It's our professional training event, and it is for practitioners. But rest assured, all the information from there will come right back here, and everybody listening will be able to hear it, take advantage of it, and make use of it. Len, look forward to seeing you, buddy.
God bless you,
Take
Joe.
care.
Keep up the good work.
We'll see you soon.
Talk to you soon.